So more and more companies are enforcing mandatory vaccinations for staff. President Cyril Ramaphosa has said that government plans to introduce mandatory vaccinations for certain activities. A government task team has been set up to look into the matter. Now we ask whether the choice of having a jab should be viewed as a human right or not. We're joined for this discussion by the Executive Director at Amnesty International, Shenilla, Mohammed. Thank you very much, Shenilla, for your time this morning. So what has your assessment of the mass vaccination campaign been? Has there been, or is there trust that has been gained, by government to its citizens?
Good morning, Dudu, and good morning to your viewers. Well, it's very clear from the numbers, Dudu, that there are a large number of citizens who are not confident and comfortable with the information they're receiving around the vaccinations, and we see that by the fact that many people have chosen not to vaccinate. So to that end, we do understand that the state is now looking at other options. However, we, as Amnesty International, we do not believe that introducing a blanket mandatory vaccine policy is the way to go.
What then is the way to go? What considerations should be made?
Well, first of all, Dudu, let me just clarify that. What we believe is that no one should be forced to receive a vaccine without their consent. And in line with the World Health Organization recommendations, we believe that governments must focus on voluntary uptake and public awareness campaigns, and these must be in the forefront of these efforts. So, that should be the priority. And this means the scientific benefits of the vaccines must be explained and disseminated in a manner that is understandable. So they really need to take stock of their messaging. Is it reaching the right people? Is it, are they taking into account the social and cultural context? This is crucial, and it's a crucial component of the right to health, because individuals and communities can only make informed decisions about their health when they are given accurate, timely, and accessible information. Now, having said that, Dudu, we do recognize that there are several international instruments that allow for the limitation of rights for the sake of public health, provided that these safeguards are consistent with international human rights law and that they meet the requirements of the principles of legality, legitimacy and necessity, and proportionality and non-discrimination.
You speak of a right to health, and I think of some conversations that are being held by some sectors of the population, right? So people saying, well, we've only got one clinic that is servicing an entire community of hundreds of thousands of people, yet here we are, we see during COVID times that we are able to have pop-up, clinics and health facilities. So our health has been not prioritized, rather, or our health systems have not been prioritized for a while now. Could this also be a leading factor in people being hesitant?
I think there are a number of factors, Dudu, and I think that, absolutely. I think that the right to health issue has not been addressed adequately. For years now, we've heard the state talking about the national health insurance, and yet we have seen millions, if not billions, of rands being stolen through corruption, even during a pandemic. So, of course, people are angry. People do not have any trust that the state is going to deliver. And, their basic health care is not being taken care of. South Africa, for example, has one of the highest rates of cervical cancer. And as we know, that cervical cancer is easily detectable through pap smears, and if caught early, is curable. And yet women are still dying of it. Women are dying in childbirth. And so, the issue of health care is definitely plays a part in the lack of trust when it comes to the state, because the state has not been able to deliver on basic human rights, which include health care.
What do you perceive some of the unintended consequences could be if governments were to implement mandatory vaccination policies?
Well, the states could justify certain vaccine requirements in particular contexts as a necessary measure to prevent the spread of COVID. So there is that in international law, especially in situations of heightened risk. But these requirements could include situations where people are not forced per se to be vaccinated. But, like we've seen you reporting earlier, the employment, schooling or freedom of movement may be contingent upon the immunization requirement. But, we have to stress that states carry the burden of justifying justifying why they are violating these basic rights under the International Covenant on Civil and Political Rights. And so it's up to them to be very clear and transparent with their people around why it's important. And again, it's very important to stress to do that this has got to be for a limited period of time. It's got to be monitored, and, it should not be abused. So, if they are going to go ahead with it, which is not something that we support as Amnesty International, then it's got to be monitored. Civil society organizations must make sure that this is not a further, violation of people's rights that will go on unchecked for a long period of time. It's got to be for a certain period of time.
Please allow me to end it here. Thank you very much for your time this morning. Shenilla Mohammed is the Executive Director at Amnesty International.